Hi, my name is Sarah Abraham, and this is Jordan, my patient, and this is my full head-to-toe assessment. So I've already washed my hands and introduced myself, of course, and explained what the assessment entails to Jordan. So first off, I'm just kind of going to inspect your skin generally. Looking at it, it does look pink, has pink tones to it, it's consistent throughout. I don't notice any rashes. He's got some freckles, but otherwise no other lesions that are concerning to me or big that I feel like need to be looked at more. I don't see any apparent masses. Thank you. Let's see. I'm going to go ahead and just kind of take a look at your arms here and look at your hands. I'm just going to go up. Looking for pain, masses. Any pain, Jordan?
Nope.
Okay. Looking at your hands here, I'm looking at your fingernails. They do not appear to be brittle in nature. They are pink and translucent. I don't notice any clubbing or like cyanosis going on. Go ahead and do some cap refill. See how well your fingers, your hands are perfusing. Okay. Cap refill is less than 3 seconds. I'm gonna go ahead and look at your hands. I'm gonna go ahead and have you flex your hands for me, looking at your range of motion of your wrists. Can you go ahead and tap your fingers together to your thumb? How fast can you do that? Can you show me? Okay, great job. I want you to go ahead and give me thumbs up. Great. Let me take a look here. All right. I want to go ahead and have you put your hands out like this again. And now with me on top of you, I want you to lift your hands up against me, okay? Go ahead. All right, I would say that's +5 strength, down, +5. All right, good strong hands. Go ahead and I want to see how strong your fingers are. Can you pinch this together? Okay, what about in this hand? All right, fantastic. Let's go ahead and take a look at your biceps. You and your elbows, fold your arms up and down for me. Okay, I'm going to go ahead and see how strong your biceps and elbows are against my resistance. Can you pull up against me? Okay, push back. All right, +5 for the biceps and elbow strength, triceps. Let's go ahead and test your shoulders. So for your shoulders, I want to see your arms above your head. I know the light's in the way, but as best you can, there you go. All right, now go ahead and put them behind your head. Now, can you fold them behind your back? And then put your arms at your side for me. What I'm going to do now is just test the strength of your arms as well, your shoulders. You can relax them, it's fine. So go ahead and push against my arms, okay? There we go, +5, okay. Go ahead and push against me here. Very strong shoulders, stronger than me. Let's go ahead and test your reflexes of your arms here. Let's go ahead and do the bicep one. So I'm going to go ahead, what I want to do is find the tendon here in the arm. So can you flex your arm for me? Perfect. So I know the tendon's right here. And I'm going to go ahead and put my thumb on it with his hand relaxed or his arm relaxed. I'm going to just tap this with my reflex hammer. Okay, +2. I find that one to be the hardest one for me to do. I'm going to do it over here. Can you flex for me? Perfect. All right, now go ahead and relax your arm. Okay, +2. I'm going to go ahead and do the brachioradialis reflex here with his arm relaxed. Okay, +2. All right, there we go. +2. All right, now let's test triceps. Okay. +2. Alrighty, let's go ahead and have you close your eyes for me. I want to see your finger on both your hands touch your nose. Alternate them. Okay, do the other one. Perfect. I'm going to go ahead and write in your hands, palm of your hands, a letter or a number, and I want you hands over.
It's a B.
Yep.
S.
Yes. So now I'm going to go ahead and place an item in your hand.
Okay.
Get 2 items out here. Here, both sides. Alright, I guess this will work. Alright, what's that?
Some type of thimble.
Yes. Alright. What are those?
Scissors.
Little scissors. Perfect. Alright. I want to go ahead and, speaking of scissors and sharp, let's test how well you feel with your skin. And when I touch you here, I'm going to go ahead and there we go. So, I want you to tell me if you feel sharp or dull with your eyes closed, okay?
Yeah.
Alright.
Sharp. Dull. Dull. Sharp. Dull. Sharp. 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 Dull. Dull.
Perfect. And then I would like you to have your hands out. I meant to do this earlier, cap refill, but have you close your eyes, okay? And I'm going to move the tips of your fingers either up or down. Please tell me which direction they're going, okay?
Okay. Down. Up. Down. Up. Down. Down.
Perfect. That's good. While you're here, I want to just go ahead and look for any lymph nodes underneath your arms. Sorry. Tell me if you have any pain.
Nope.
No pain. I don't feel any axillary lymph nodes. I don't see any swelling or redness. I'm going to go ahead and take a look at your hands here, your head here. I'm feeling for any masses, decompressions in the skull. I'm looking at his hair. It does not look brittle to me, or he doesn't have any patches of hair missing. I'm going to just kind of start feeling on your head here. I'm feeling for your sinuses. Any pain?
No.
Okay. No pain?
Mm-mm.
None? Okay. What about now?
Nope.
I don't feel any crepitus. I don't hear anything that would signify to me like dullness that he had maybe some congestion or an infection going on. I'm going to go ahead and feel your temporal arteries here. These little things here, +1. And then go ahead and smile for me. Okay. Frown. Raise your eyebrows like you're shocked. Puff your cheeks out like a pufferfish. And do a kissy face. Perfect. All right, looks good. So I'm just going to go ahead and take a look at your eyes here. See how well you see. And if there's anything else going on, okay?
Okay.
Just some reflexes. So just go ahead and look at my nose here. I'm looking for the corneal reflex. So I'm looking for where the light is in each of the pupils. And they both appear to be in the same spot bilaterally in each eye. I'm going to go ahead and test your field of vision. So please follow my finger. Don't move your head. Just use your eyes, okay? Okay. Go the other way. Okay, I don't see any extraocular eye movements is kind of what I'm looking for with the 6 cardinal fields of vision. Let's grab our little chart here, and I'm going to cover one eye, and then I'm going to do the same. I'm looking for any deviation of the other eye that's not uncovered. Okay. No deviation of the left eye, no amblyopia, no strabismus. Okay. So next, what we're going to do is you're going to close one eye, and I'm going to close the same eye. I'm going to test your field of vision, the confrontation test.
Okay.
So let's go ahead and do your right eye. Okay. So I'm going to hold up some numbers in my hand, and you tell me how many fingers I'm pointing. Okay.
Okay. 1, 2. 1, 2.
Okay. Perfect. We're going to the other eye. Left.
2. 1, 2. 2.
Perfect. So I don't suspect you have any deficits in your peripheral vision. Let's That's what I'm testing here. Okay, we're gonna go ahead and just kind of palpate the outside of your eyes. I'm looking for any masses, nodules, also pain. Did you have any pain?
No.
No, okay. Let's go ahead and look at your eyes here. I'm gonna look at your conjunctiva. They are pink. Your sclera is white. Your pupils are equal and round. They're definitive on each side, and so is his irises, which they're blue. Okay, so let's go ahead and look at the inside of your eye. So I'm going to look at your right eye first with my ophthalmoscope. So first, what I'm going to do, go ahead and look forward for me. I'm going to start off by looking to see for a red reflex, which he does have, and I'm just going to kind of go in, and I'm looking for cotton bodies, which I do not see. His optic disc is creamy in color. I do not see any vessel changes like narrowing or papilledema. And go ahead and look at your other eye now, okay? With my left eye. So, left eye also has a red reflex. I see his optic disc here. It is also creamy in color. I'm also looking at his vessels. I'm gonna go look at those. No narrowing or cotton bodies on the left eye. Okay. And then let's go ahead and test your vision. Okay. So I'm going to stand about 6 feet away from you. Are you wearing any corrective lenses at all?
Yes, contacts.
Okay. So what we'll do is we'll go ahead and see how well your corrective lenses are helping you. Do you know if you're narrow or short-sighted or far-sighted?
I am nearsighted.
Okay. So I'm going to go ahead and step back here. Go ahead and cover one eye, and then we'll test the other afterwards. And read starting at the top and go down to the bottom as far as you can. Okay. All right. Go ahead.
ELTFPHOLCF DHJBSEPTZO CFDHJ LTFPH.
Perfect. All right. Let's go ahead and test the other eye, your right eye.
ELTFPHOLCF DHJBS EPTZO CDFHJ LTFPH.
All right, perfect. You have 20/20 in both eyes with your corrective lenses on. Let's go ahead and look at your ears. So looking at the right ear over here, he does have a little laceration on this ear from doing some housework, putting up trim. Trim fell on his ear, but he's okay. So I don't see any masses. I see a little redness at the pinna up here from the laceration. I'm just going to go ahead and gently touch the side of your ear, okay, and let me know if you have any pain. Any pain anywhere?
No.
No, I do not feel any pain, or not feel any pain, but feel any masses. I don't feel edema. So let's go ahead. Alright, so I'm just going to touch this ear over here. This ear doesn't look to have any lesions, masses, any kind of rash, because that rhymed. Did you have any pain where I was touching that ear?
No.
Okay, perfect. Alright, so let's go ahead and take a look inside your ears with my otoscope. Perfect. Alright, so with examining adult ears, I want to do up and away, back. So I'm going to go ahead into his right ear. Okay, I see some orange cerumen. I see his umbo, it is gray. I see the malus and the umbo, and the conal light is at 5 o'clock at the right ear. I don't see any redness, I don't see any masses at all. The tympanic membrane is concave in nature. I'm going to go to the left ear over here. Okay. The conal light and this ear is at a 7. There is a small amount of cerumen that is also orange and wet appearing. I don't see any discharge. The tympanic membrane is also concave on this side. You doing okay? I do not. I see his malus and his umbo on this side as well. I don't see any masses, redness, erythema. Tickle? No. Okay. So let's go ahead and test your hearing, okay? So I'm going to stand behind you on each side. We'll do it to both sides. I'm going to whisper some words, right, while you plug the opposite ear.
Okay.
And I want you to repeat back what you hear to me. Okay?
Okay.
All right. All right. Can you see my mouth?
Nope.
Okay.
Cat, bat, sat.
Correct. All right. Let's go to the other side. Good job. All right.
Staircase, daydream.
Yes. Good job. That was a good one. Okay. So I'm gonna take my tuning fork, and I'm gonna test how well your conductive hearing is,
Okay.
whether it's sensory neuro or through the bone. Okay. So we're gonna do the Weber test. The Weber test is where I hit the tuning fork and I place on top of your head, and you tell me where you hear it the loudest, or if you hear it equally in both ears. Okay.
Equally.
Okay. And this tuning fork, I don't recommend buying. It's hard to hit. Okay. But it'll do as a prop. All right. So for the Rhine test is the next test we're doing. I'm going to hit this like I did on the top of your head, but I'm going to place it in the back of your ear.
Okay.
And then when you can no longer hear it, I want you to tell me, and I'm going to flip it to the front, and then I want you to tell me when you no longer hear it again. Okay.
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 Stop.
Okay.
Stop.
Okay. So air conduction, the front of the ear should be longer than bone conduction. If it is not, it signifies hearing loss. Okay. All right.
Stop. Stop.
Okay. I hit that a little bit better that time.
That's a while.
Yeah, I did. So it seemed to me that you did have air conduction that was longer than the bone conduction. I would have a watch on, but my watch is broken. So, but I do know that I need to be aware of how much time I spend with each side, whether behind the ear or in front of the ear. Let's go ahead and look at your nose here, your lovely nose. I'm just going to touch the outside. Looking at it though, I don't see any redness. I don't see any masses. I don't suspect your nose is broken looking at it, but I'm going to know how to feel it and tell me if you have any pain.
Nope.
Okay, the cartilage of your nose is firm. I do feel a lump here, like maybe you had broken your nose at one point. I know you have a history of doing wrestling and sports, so, and you're also a boy, so I'm sure there's some fights with your twin brother. So looking at your nose here too, I see that your septum, if you tip your nose back a little bit, it does deviate a little bit to the left. Let's go ahead and test the patency of your nose. So I want you to basically claw one side, breathe in and out. Okay, and then do to the other. Usually there's one side of the nose we breathe better out of. That one, okay. It's good to know. I'm just going to go ahead and take a look at your nose here. All right. So I'm just going to tip your nose back a little bit, okay? So the nasal mucosa is like a pink, but the turbinates are dark pink. They're moist. They're not pale or boggy. I don't see any drainage, masses, or polyps in there that might obstruct his ability to breathe, or drainage. I don't know if I said that. The right nose here, sorry, is also pink and moist. The turbinates are a dark pink as well. They don't look swollen, or doesn't look swollen. I don't see any masses, or polyps or drainage in that nose at all. So the fun part, my favorite part of assessing the nose is checking how well you smell. You can identify the smell. What I'm going to do is have you close your eyes, and I'm just going to waft this smell underneath your nose, and please tell me what smell it is.
Okay.
Identify it, okay?
Vanilla.
Yes. Yum.
Yum.
Yum. All right. So So next, let's go ahead and look at your mouth. So right off, I see that his lips are pink. They are symmetrical. He doesn't have any ulcerations or lesions or rashes around his mouth or discoloration around his mouth. I'm not concerned with his respiratory status, oxygenation status, because his lips are pink and not blue or dark red. So, can you smile for me? Okay, I'm looking at his teeth just from the outside so far. His teeth are white. They're very symmetrical. You have braces? They're very perfect. They're nice. I don't notice any dental caries on the outside. I'm looking at, can you smile again, big? I'm looking at his gums. I don't notice any hyperplasia. They are pink. So, he looks like he's getting good oxygenation. Go ahead and open your mouth for me. Tongue blade. So the teeth, the anterior side of his teeth, or the dorsal side of his teeth, the tops of his teeth is what I'm trying to say. They don't look to have any cavities, dental caries. They're overall still white. I see his Stenson ducts bilaterally on his cheeks here, and his mouth is moist. The back of his throat is pink. His tongue looks like it fits his mouth. There is papillae on top of it. I don't see any ulcerations on his tongue. Let's go ahead and look at the back of your throat, okay? You say, ah. The uvula rises symmetrically. It does not deviate, actually. He does have tonsils in the back of his mouth, but they are a +1. So, let's go ahead. I'm sorry, but I want to test to see if you have a reflex. It's called a gag reflex.
Okay.
So what I'm going to do is just touch the back of your throat, okay, with a longer tongue blade, okay? All right, ready? Sorry. But you do have that reflex. That's there. Okay. My least favorite part of this is palpating the oral cavity. If I was in an office setting or at the hospital, I definitely would have my hands washed. I definitely would have gloves on. But in this case, we have limited resources, so we will use gauze, what we do have at home. So I'm just gonna run my finger in your mouth. I'm checking for any masses. I'm checking for pain. So please let me know if you have any of those. Okay. Okay. No pain?
No.
Okay. Besides it being just uncomfortable. Okay. I want you to go ahead and just swallow for me. Okay. The swallow is symmetric. And then the last but not least, to test your tongue strength, I want you to go ahead and push against my hand. Okay. And then do the same to the other. Perfect. I don't know if I palpated your tongue. Maybe we should do that real quick. Needs to okay, I'm just gonna take a donut. You have any pain? I don't feel any masses.
No.
Okay, perfect. Alright. So let's go ahead and look at your neck, since I've already looking at the swallowing. His neck does appear to be symmetric to me. I don't notice any masses. The color is pink, and it has pink tones and it's consistent throughout. I don't see any lesions on his neck as well, or any pulsations. So I'm just going to go ahead and touch your neck, okay? I don't feel any lymph nodes or masses at all. I'm going to go ahead and feel your trachea here. Your trachea feels midline. What I'm going to do is, since I'm already touching your neck, I'm going to just feel for any lymph nodes from your head and neck, okay? So we start here. This is preauricular lymph nodes, postauricular, tonsillar, parotid, submandibular, submental, and we have deep superficial cervical, and then deep, posterior cervical, and then supraclavicular. And I cannot feel any lymph nodes that are swollen here. Do you have any pain? Okay. All right, perfect. So let's go ahead and just kind of palpate your thyroid. Okay. Your thyroid is very smooth, kind of rubbery. Can you swallow for me? It does not feel enlarged to me. I don't feel any like asymmetrical swelling on one side or the other, nodules on the thyroid. So let's go ahead and test your head movement, okay? How well your neck moves. So first I want you to do like an exaggerated yes. Yes, okay. Now give me a no. Show me how far you can do that, okay? Now can you bend your head to your shoulders, your ear to your shoulders, without moving this? You don't have to, it's, yeah. Okay, do you have any pain with that?
No.
No, okay. Do you feel stiff, like you can't move it?
No.
Okay. Let's go ahead and have you shrug your shoulders for me. Okie dokie, so do that again. Perfect, okay. Let's go ahead and have you push your chin against my hand. Show me how strong your head is, your neck. Perfect. So you have good strength, I would say full strength in your neck, full range of motion in your neck. I'm going to go ahead and have you turn for me so I can go ahead and listen to your back, okay? Okay, so, alright, so looking at Jordan's back here, his chest in general, going from front to back, his anterior posterior diameter is bigger than his transverse diameter. So to me that signifies that he's pretty healthy, at least from this standpoint, and that he doesn't have any respiratory disease like COPD, where he has hyperinflation of his lung causing the barrel-chested appearance. So first, I do not see you, when I'm looking at you, talking to you, you don't seem to be in any respiratory distress. He does not seem to be using any accessory muscles. He doesn't have any heaves. He's got good coloration in his back. It's pink, pretty consistent. He has a few spots in his back, lesions-wise, just little acne pustules, which is normal for people to have. Not too bad. I'm going to go ahead and palpate expansion to see how well you breathe in. Can you sit up straight for me? Thank you. So what you do is you put your hands at the bottom here and push in a little bit. Go ahead and take a deep breath for me. Good. And then let's go ahead and do tactile fremitus. I want you to go ahead and say 99.
99. 99. 99.
Okay, and the vibrations are equal on each side, which I'm looking for. If not, I'm concerned for consolidation and possibly infection, something of that nature. I'm going to go ahead and do some percussion over his backside, and this is also where I'm looking for resonance throughout and no dullness or consolidation. So we try to avoid the scapula here. Okay. Lots of muscle. So he does sound resonant throughout. I'm going to go ahead and start listening to you. We're going to do agophony. So when I place my stethoscope on your back, I want you to say E for me, okay?
Okay.
Okay. Okay, go.
E. 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 E.
Okay. So the E, I heard E, not A. If I heard A, I would be concerned for consolidation as the sounds of his voice, the vibrations change through any changes in the lung, through air and through fluid. Okay, so I'm going to go ahead and listen to your breath sounds, okay? And then I'm also on your back, and then I'm going to listen to the ones on your side here. And just take a deep breath in and out, and let me know if you need a break, okay?
Okay.
Can you lift your arm up a little bit for me? I'm just going to listen to your side and take deep breaths for me. Okay, 3 sides on the right. Okay. Two over here. Still doing okay? Okay, so I do not hear any adventitious sounds. Jordan's lung sounds were clear, equal bilaterally. All right, let's go ahead and since I'm back here, I'm gonna just see if you have any kidney pain. Okay, I'm gonna place my hand on your lower back, and I'm gonna hit it, and you tell me if you have any pain. Okay.
Nope.
Okay.
Nope.
Okay. Perfect. No pain there. I'm just gonna go ahead to your front side and pretty much do the same thing over there. Okay.
Okay.
So the coloration on his front still, it looks pink and consistent throughout. As I said earlier, he does not just seem to be dyspneic or in respiratory distress. He's able to speak in full sentences with me. So I'm going to go ahead and just listen to your front side. Okay. After I palpate a little bit, I'm just going to make sure I don't feel any lumps. I don't feel any lumps in his chest at all, any pain. You have pain?
No.
Okay, good. I thought you were saying yes, I have pain. Okay. And then that's no tenting for skin turgor. I'm gonna go ahead and listen now. Okay, so Jordan's lung sounds in the front are equal bilaterally. They're clear. I did not hear any adventitious sounds like bronchi or rales. Next, I'm going to have you lay down, but first before we lay down, because I want you to be able to see that I can identify these landmarks, I'm going to do it while he's sitting up. That way when we're laying down, you know what I'm looking at. I'll also verbalize it. So when we go to listen to heart sounds, there are some landmarks that we use to listen to areas of the heart. The first landmark that is commonly known is the aortic valve area. It's at the second intercostal space, right of the sternal border, and that would be right here. Can you face the camera a little bit more for me, Jordan? There you go. There you go. So this is the aortic valve, and then I would want to go over to the pulmonic valve over here, and to the second intercostal space, left of the sternal border, is where you would hear the pulmonic valve, and just below that at the third space is Erb's point, where S1 and S2 is heard, and below that is the tricuspid valve, and then below that is the mitral valve area, or the apical pulse, or the point of maximal impulse. Okay. So let's go ahead and have you lay down for me, Jordan. Let me get something for your feet. That sounded awfully comfortable. Put your feet up on there. That's fine. Okay, so looking at Jordan's chest here, I am definitely going to go ahead and just feel for any pulsations, because I don't see any pulsations on his chest at all. Pulsation or heaves. Okay. All right. So I'm gonna go ahead and find or show the apical point pulse, or the point of maximal impulse. This is right underneath this left breast here. The pulse, when I'm feeling it, is gentle and brief. If I go ahead and auscultate it here. His rate and rhythm is regular. I did not hear any murmurs or clicks, or any extra heart sounds like S3 or S4. If we go ahead and listen to the 5 landmarks and eighth man, aortic valve, with the pulmonic valve. I don't hear any murmurs or clicks. Herb's point. I hear S1 and S2 clearly. I don't hear any murmurs or clicks. I don't hear any extra hard sounds like S3 or S4 to the tricuspid valve here. I don't hear any murmurs or clicks. And then the mitral valve with the diaphragm as well. I do not hear any murmurs or clicks. I also do not know any friction rubs. Listen here. So no murmurs or clicks with the bell at the aortic valve. The pulmonic valve does not have any murmurs or clicks. Herb's point, S1 and S2 are still clearly heard. I do not hear any murmurs or clicks here. No S4, S3s. The tricuspid valve doesn't have any murmurs or clicks. And of course the mitral valve. I do not hear any murmurs or clicks as well. Okay. So I want your legs to be relaxed because we're going to go ahead and look at your abdomen while you're laying down here, okay? Are you semi-comfortable? Okay. So I'm just looking at his abdomen here. His abdomen is flat. I don't see any pulsations. Neither at the apical pulse or the aorta. Well, as he's breathing here, I'm going to go ahead and just, look at his skin here. I don't see any abnormal vasculature like you would see with like liver disease. He has a pink toned stomach that's consistent throughout. I don't see any lesions, discolorations. I don't see any masses at all. Can you raise your head for me, Jordan, while you're laying there? As he raises his head and flexes his abdomen, I don't see that he has any hernias or masses that I can't see. Otherwise, I'm going to go ahead and listen to your bowel sounds, okay? Okay. So his bowel sounds are present in all 4 quadrants. They're no more active. Let's go ahead and listen to the vasculature in the stomach, starting with the aorta. No venous hums. I'm listening to the renal arteries next. The left and right renal arteries do not have any venous hums. I don't hear any bruits. And then iliac arteries. I don't hear any venous hums here. Alrighty. I'm going to go ahead and percuss your abdomen, okay? So his abdomen is tympanic throughout. Let's go ahead and percuss your liver here. Okay. So I'm going to start up here. To differentiate between resonance and dullness, the liver should be dull on percussion. So next I'm gonna go from the bottom up. So his liver is about 7 centimeters in span. Okay. Next I'm gonna try to percuss the spleen. And I'm also gonna use the same tricks as I'm gonna go from an area that I know the lungs, it should be resonant, looking for dullness beneath the ribs, outside of the ribs, and see if I can't find the spleen. So I cannot find the spleen. I don't hear any dullness. I hear resonance and tympany as I'm looking for the spleen. I'm gonna lightly palpate your stomach next door, and please tell me if you have any pain, okay?
Yeah.
Okay.
Nope.
Okay, next I'm gonna do a deeper palpation. Please let me know if you have any pain or discomfort, okay?
Yeah.
It's not gonna be as comfortable as a light palpation. Okay?
No.
It's always nice to ask your patient before you palpate their stomach if they need to go to the bathroom or if their bladder is empty, as a kindly reminder. Next I'm going to try to palpate the spleen here. So I want you to take a deep breath in and then let go, okay? Okay, I feel the liver just right here, 1 centimeter below the rib, the last rib. Next I'm going to try to palpate the spleen off to the left-hand side. I cannot find the spleen at all. I don't feel any masses there either. So next let's go ahead and listen for the femoral pulse. As Jordan very kindly let me borrow him for this, he is not as comfortable not wearing very skimpy or no shorts at all. So the femoral pulse I know is right here, and I can feel his femoral pulse here, and it feels like a +2 to me. And then over here, I'd say it's a +2. Well, I'm here feeling, I don't feel any inguinal lymph nodes that are swollen. Do you have any pain, Jordan?
No.
Okay. I'm just going to go ahead and listen to hear the femoral pulse. I'm listening for bruise. And I'm not hearing anything remotely like a bruise. Okay. So next I'm just going to take a look at your legs, Jordan.
Sure.
If you want, you can go ahead and sit up for me. Alright. So looking here at Jordan's legs, they seem to be symmetrical in length for me. I'm going to go ahead and palpate your legs. Let me know if you have any pain, okay? While I'm palpating, I am looking for pain, but I'm also looking for edema. Commonly you see edemas on the shin area and in the ankles. I do not feel any edema at all. I'm going to go ahead and palpate your pulses, okay? Should I move the camera down? Okay. Maybe like this. If you want, you can put your legs there. So I feel his dorsalis pedis pulse, and it is a +2 here. It's a good one. And then his tibial pulse. Thanks. +2 on both sides, right behind the ankles here. Medial aspect. Let's go ahead and take a look at your toenails since we're already down here. So looking at your toenails here, your toes are a little bit cold, but it's kind of pulled anyway. But they are pink and they are translucent. They do not look brittle to me. He has all of his toenails. I'm going to go ahead and do cat refill. Just looking to see how well your blood gets to your toes, okay? So his cat you're feeling his toes are good. It's less than 3 seconds. I'm gonna do the same thing I did with your fingers, where I lift your toe or your finger up. I'm gonna do it with your toes.
Okay.
Have you close your eyes and you tell me which way you feel your toes going, okay?
Okay.
Alright, ready?
Up, down, up, down, up, up, down, up, down, up.
Okay, perfect. Alright, so next I want to test the range of motion of your hips. This requires you to lay back down for me. Okay. Oh, thanks. Okay. So what we're going to do here to test the range of motion of his hips, I'm going to support his leg, and we're going to flex his hip forward, have him flex his hip forward, and extend his hip back. Okay. You bring it back. Okay. Perfect. All right. So to test your strength here, I want you to push against me. Okay, for your leg, bring it forward. Okay, good. And then bring it back. Okay, perfect. Let's go ahead and do that to the other side. Oop. Okay. All right. So go ahead and go forward with your hip. Okay. All right. And go back. Perfect. Thank you. So I want you to resist me pulling on your leg and push it forward. Perfect. All right. Now push back. Perfect. All right. I want to have you roll on your back. And could you do me a favor? I know I'm going to hold this leg up. I want you to put this leg out, and I want you to bring it outwards, and then bring it in underneath this leg. So I'm testing abduction and adduction. Let's go ahead and do it with the other leg. Yeah, out. Thank you. Okay, perfect. All right, you can go ahead and sit up again. Okay. In a normal setting, my exam table would be much more facilitating of this than my dining room table. Okay. So I want to test your reflexes of your lower extremities, but I also want to do sensation. I'm going to close your eyes again, and I'm just going to do sharp dull, okay?
Okay.
And you tell me what you feel, okay? Go ahead and close your eyes for me.
Sharp, dull, sharp, dull, sharp, sharp, dull, dull.
Okay, good job. All right, let's go ahead and test your patellar reflex, okay? There we go. Sorry. 1, 2, 3. There you go. All right. +2, and his patellar reflex. Also like to mention that his hips have full strength +5. And then for your knees, let's go ahead and have you flex them out. And then if you can flex them in. Normally I would want to see the legs go up and in, or we can have you lay back on the table. And you can put your legs on the table for me and bring your heels as close as you can onto the table next to your butt. So I would say Jordan has full range of motion of his knees. Sit back down. So to test your knee strength, I'm going to have you kick against me and bring it over here. Okay, +5, bring it away. +5. Okay. So +5 totally. And then let's go ahead and test your Achilles heel reflex. So what I do is I hold the bottom of the foot like this. You can relax your leg. But I'm going to hit the back of his heel here. And I'm going to look for flexion of his foot. Extension. There you go. Feel it? Okay. I would say +2 in both of his Achilles reflexes. Okay, Ducky, can you run your heels down your shins for me? Okay, the other one as well for coordination. So I'm going to have you stand up at this point. I want to see your gait, how you walk. Can you go ahead and walk for me? So looking at his feet, Jordan doesn't seem to be concentrating that much on walking. His gait looks coordinated and symmetrical. Can you stop there? And then I want you to walk heel to toe towards me, please. Okay. It's also coordinated and symmetrical. Next, I want you to walk on your heels. Okay, and then tiptoes. Okay. All right. I would like to also kind of look at your back next too. So I'm looking at the curvature of Jordan's back here. I do not see any overt like kyphosis, lordosis. I do not see any like lateral deviation of his spine here. The scapula do not wing outwards. I do not notice, or they don't have much winging at all, but I don't see any like pelvic tilting here. I don't see any masses as well. Can you go ahead and bend your back forward, or bend forward for me? I do not see any changes in the position of his spine. He's able to bend forward. Can you bend forward as much as you can for me? So Jordan seems to have full range of motion going forward. Can you go back for me? Okay, oh that's good. Yeah. He's got full range of motion going backwards. Can you lean side to side for me as best you can? There you go. Alright, I would say Jordan has full range of motion of his back here. Okay, just gonna have you turn around. We're gonna do Romberg sign. So Jordan here is gonna stand with his feet together. Okay? Alright, and so he does have to be swaying right now with his eyes open, but we're gonna have Jordan close his eyes, and we're looking for swaying, checking his balance. Okay, I would say Jordan has good balance. You can open your eyes. I don't think you have a positive Romberg sign. I think you're good. Alright, and that concludes my